What is the difference between Malar and Discoid lupus rashes? Lupus is a complex autoimmune disease that can affect many parts of the body, including the skin. Among the skin symptoms, rashes are quite common, but not all rashes are the same. Two of the most recognized types are the malar rash and the discoid rash. Understanding how they differ can help in recognizing lupus symptoms and seeking appropriate medical care. The malar rash is often called the butterfly rash because it appears across the cheeks and the bridge of the nose, creating a shape similar to a butterfly. This rash is usually red or pink and can be flat or slightly raised. It tends to appear suddenly and is often triggered or worsened by sun exposure. The malar rash is considered a hallmark of lupus and is present in many people with the disease. However, it does not usually cause scarring and tends to fade with treatment or when the flare subsides. Discoid lupus rash, on the other hand, appears as round or oval patches that are often thicker and more scaly than the malar rash. These patches are typically found on areas exposed to sunlight, such as the scalp, ears, or face, but they can also appear on other parts of the body. The discoid rash can cause permanent skin changes, including scarring, hair loss if on the scalp, and pigment changes. It is more localized and persistent than the malar rash and may take weeks or months to heal, often leaving behind scars or skin discoloration. While both rashes are associated with lupus, they have different appearances and implications. The malar rash is usually symmetrical, affects the cheeks and nose, and is a key feature in diagnosing systemic lupus erythematosus. The discoid rash is more localized, can be scaly and thickened, and is characteristic of discoid lupus erythematosus, a form of cutaneous lupus that may or may not be associated with systemic disease. It is important to remember that skin rashes alone do not confirm lupus. Many skin conditions can resemble lupus rashes, so diagnosis involves a combination of clinical evaluation, blood tests such as anti-nuclear antibody tests, and sometimes skin biopsies. If you notice any unusual skin changes, especially if they are persistent or worsening, consult a healthcare professional for proper diagnosis and management. In summary, the main differences are that the malar rash is a flat, red, butterfly-shaped rash across the cheeks and nose, often temporary and without scarring, while the discoid rash appears as thick, scaly patches that can leave scars and pigment changes. Both are important clues in understanding lupus but requiring medical evaluation for accurate diagnosis and treatment. Always seek advice from a healthcare provider to get personalized care and support.